All right, Dr. Surad Darabi, welcome to Know Your Investigator session or section of the CARES Connection newsletter. Appreciate you joining me. Tell us a little bit about you and what you do.
Hi, Shadi. Thank you so much for the invitation. So excited for this talk, casual talk with each other.
Yes.
As you said, my name is Surad Darabi. I'm a clinical genomics scientist, managing the precision medicine program here at Hoag, which is the community local hospital in Orange County, California. Newport Beach. We have two locations, Newport Beach and Irvine. So we have this cancer center that about 5 years ago, Dr. Demir, which is our director of the precision medicine program, started the program, and then he hired me to work with molecular profiling results, help with the clinicians on interpretation and presentation at tumor boards. So we started having molecular results in all our tumor boards. We have about 33 tumor boards that we present molecular results per month. So my background, Persian American, Iranian American, born in Iran, raised in Iran. I have my master's and bachelor's from Iran. Bachelor is in molecular biology, master's is in microbiology. Then I moved to United States with my husband 21 years ago. And we moved to Clemson, South Carolina, got my PhD in genetics from Clemson. And we moved to California through job. So before Hoag, I worked at Ambry Genetics. I was part of the team called Lunch Team, which we would design panel, having gene-disease relationship. I was doing variant classification for panel design, also involved with exome sequencing, novel gene assessment. And then through a mutual colleague at Ambry, I got to know Dr. Demir, and this is how I ended up here. Very nice. It's almost 5 years. I can't believe it. And since then, in 2018, since Hoag had this relationship with CARES, I got to work with all CARES team since 2018.
Well, we love having you, and I think Hoag, while it is not university or medical school based, you have built an amazing program that is really doing a lot of research and very, very nice work. Just briefly, are there any areas within genomic and precision medicine research that you are specifically interested in that you would like to share with viewers?
So as you know, I'm focused in all solid tumors, and recently we started our heme malignancy program. So I start learning more about heme malignancy. So I focus on all solid tumors, but homologous recombination pathway is what I really enjoying focusing on. But at the same time, I'm focusing on all solid tumors, anything biomarker driven, variant classification. We just published a paper with CARES POA on BRCA reversion mutations, pan cancer, a couple of months ago. I'm also interested in fusions and all solid tumors. We last year published another paper with POA on oncogenic fusions in melanoma. So I don't have any specific focus because I have a broader scope of work.
33 tumor boards, that's a lot.
So yes, that's 33 tumor boards, and I have our own molecular tumor board, which is basically expanded version of our other tumor boards, but all molecular cases are presented at tumor boards. So we just hit, apparently, a couple of weeks ago, 5,000 tumor samples sequenced at CARES. We just had a press release, I think, or it was a post by Hoag Foundation that we hit that 5,000 cases. So not only I review the cases that we sent to CARES for profiling, I review other labs as well, liquid biopsies, germline results, and any other cases that was presented at tumor board and it was profiled before even
You know what I like about what you do, Surat, is that you're able to take the your background, the research background and the science, and you apply it pragmatically in clinical, how this really helps patients. And I think that's really the sweet spot, I feel, because we have to take that science and eventually that patient in front of you who is being seen, you know, as much as we care about the paper where it shows, they just want to know, how is it going to help me when I'm battling cancer?
exactly. That's how I feel is fascinating what I do and love what I do is I get to have that science and apply it to clinic as much as possible. And at the end of the day, if we help one patient, that made our day. And here at Hoag, we are collaborative, and even sometimes patient need immediate attention over the weekends. The entire team work together to come up with help of the patients, which is very rewarding for me to be able to do that. At the same time, is also good for organization to have a program like this that would help their patients. We're not directly communicating with patients, is through their medical oncologists or treating physicians. We also help, at Hoag, we have this reflex testing program, which is pathology initiated orders based on certain criteria. We send tumors for profiling. We also often get a lot of questions from different clinicians that what tests we suggest for that a specific patient. If it's very, rare case or very unusual case of presentation of that disease, we try to help to offer the best possible test for patients depending on the situation. So tumor boards are really helping also to add more molecular profiling or germline testing for our patients too. I have one case recently, I don't know if I can talk about it. The patient had a gastric cancer. It was not a Hoag patient, it was outside Hoag. And the germline testing was done. And Kara's report came back with a CDH1 mutation. And I went back and looked at the germline result, and the panel didn't include gastric cancer genes. So this review, I went to page 10 of the germline result, and then look at all the genes listed. I said, oh, this is not listed. So we suggested the germline testing confirmation for that patient. So we, on the top of what other clinical trials or treatment options, we try to help them with understanding with our background in germline, also with that would help them with their families, themselves, or we put them in high-risk programs that we have, depending on the situation.
Well, thank you so much for spending some time with me. I really appreciate and getting to know you and getting to know the amazing work you're doing at Hoag. Dr. Surat Darabi, thank you for joining the Cares Connection newsletter.
Thank you so much for having me. I hope you have a great day.